Carcinoid tumour. Carcinoid tumours are a subset of neuroendocrine tumours, NETs, that arise from enterochromaffin cells and are capable of secreting biologically active substances, particularly serotonin. They are typically slow-growing and most commonly found in the gastrointestinal tract, especially the small intestine, appendix, rectum, and colon. In some cases, they produce a characteristic clinical syndrome known as carcinoid syndrome. Peak incidence. Most frequently diagnosed in adults aged 50 to 70 years old. Slightly more common in females and often discovered incidentally during surgery or imaging. Pathophysiology. Carcinoid tumours originate from neuroendocrine cells in the GI mucosa. These tumours secrete vasoactive substances such as serotonin, histamine, prostaglandins, and tachykinins. When confined to the GI tract, secreted substances are typically metabolized in the liver and do not enter systemic circulation. Carcinoid syndrome occurs only when liver metastases are present, allowing substances to bypass hepatic metabolism and enter systemic circulation. Right-sided heart involvement is typically due to first-pass pulmonary filtration. Left-sided lesions are rare unless there is a right-to-left shunt or bronchial carcinoid. Symptoms: diarrhea and abdominal cramping, wheezing or bronchospasm due to serotonin or histamine release, flushing, which can be sudden and episodic, especially with alcohol, stress, or certain foods, palpitations or dyspnea in cases of carcinoid heart disease, and weight loss, often despite normal or increased appetite. Signs: cutaneous flushing, typically episodic and red-purple in color. Pellagra due to niacin deficiency. Tryptophan is diverted to serotonin synthesis. Carcinoid heart disease. Right-sided valvular fibrosis, commonly tricuspid regurgitation and pulmonary stenosis. Hepatomegaly, if liver metastases are present. Diagnosis: biochemical markers. 24-hour urinary 5-HIAA, 5-hydroxyindoleacetic acid. This is the primary metabolite of serotonin and elevated in most symptomatic cases. Plasma chromogranin A. This is a sensitive but non-specific marker for neuroendocrine activity. Imaging studies: CT or MRI of abdomen and pelvis to assess primary tumour and metastases. Somatostatin receptor imaging, for example, gallium-68, dotatate PET-CT. This is highly sensitive for neuroendocrine tumours expressing somatostatin receptors. And abdominal ultrasound, which may detect hepatic metastases but is not first line. Histology and biopsy. Endoscopic or surgical biopsy for tissue diagnosis. Histopathology. Small uniform cells with salt and pepper chromatin pattern. Immunohistochemistry positive for chromogranin A and synaptophysin. Complications: carcinoid syndrome only occurs with hepatic or pulmonary metastasis. Carcinoid heart disease, progressive right-sided heart failure due to valvular fibrosis. Bowel obstruction or intestinal ischemia due to mesenteric fibrosis or tumor bulk. Hormonal syndromes, rare secretion of ACTH, Cushing's, GHRH, acromegaly, or insulin-like peptides. Management: surgical. Surgical resection of the primary tumour plus or minus involved lymph nodes is first-line treatment when resectable. Appendiceal carcinoids less than 2 cm without high-risk features may not require further resection. Medical: for unresectable or metastatic disease. Somatostatin analogues, for example, octreotide, eanreotide. These reduce hormone secretion, control symptoms, and may slow tumour progression. Tryptophan hydroxylase inhibitors, for example, telotristat ethyl. These are used in combination with somatostatin analogues for refractory diarrhea. Targeted therapies, for example, everolimus and sunitinib. These are considered in progressive or high-grade tumours. Palliative chemotherapy. This is reserved for poorly differentiated or aggressive neuroendocrine carcinomas. Peptide receptor radionuclide therapy. This delivers radiation to tumour cells via radio-labeled somatostatin analogues. Symptomatic support. Diuretics for carcinoid heart disease, vitamin supplementation, for example niacin to correct pellagra, and antidiarrheal agents and nutritional support. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today